we bring in Anjali Khemlani for the latest. Anjali?
Thanks, Adam. Yep, today we got the data out of Pfizer in advance of the meeting on Thursday that's going to really decide whether or not the FDA gives clearance and that emergency use authorization to the company, which is largely expected. We know that as it stands right now, health systems across the country are gearing up to deliver that to that first group of individuals, including hospital staff and nursing home residents. Some are already telling their teams to get ready for a vaccine by December 15th. So we know that this is supposed to go along. We know we got indications, especially once the UK had already approved it, that this was going to go forward. So really not too much expected in terms of a surprise. On the note, though, of the U.S. and the doses, we saw the report yesterday, New York Times reporting that the U.S. government did decline to purchase more than the 100 million doses promised from Pfizer. And of course, that is of concern because that means that without what is expected to be an approval for Moderna, there might not be too many more doses for the rest of the rollout of a vaccine. Now, the White House and other government officials have said that, of course, at that time, which was in the summer when Pfizer was offering these additional doses, it was a matter of not knowing really the efficacy of the vaccine. And the idea was to be more prudent and not put all eggs in one basket. And that was something that officials at the time had repeatedly said, that there needed to be, quote unquote, multiple shots on goal. So as it stands right now, we're still waiting for word on what that means. And Moderna, as we know, is next week for that FDA hearing as well.
Anjali, you mentioned the New York Times article, and I just want to drill a little bit deeper into that because the U.S. government giving up the option to buy more of the vaccine in advance, is this being viewed by some as a mistake by the administration, or is there any value to the argument that it does make sense to diversify, I guess, the nation's vaccine arsenal that we could potentially have?
It's a mixed bag. In fact, we had former HHS Secretary Kathleen Sebelius on earlier, and she said that hindsight is 20/20. And I think that's the view that some are taking, though, at the time, we really didn't know that Pfizer was going to come out ahead. I believe, if I recall correctly, at that time, we didn't even know what the right efficacy data was. Dr. Anthony Fauci had said in the summer that a 75% effective vaccine was going to be acceptable. So a lot has changed, and that kind of highlights, what has been happening and how quickly things have been changing over time. Of course, we know that President Trump is supposedly going to be issuing some sort of order which would prioritize the U.S., and that's expected at today's vaccine summit, but no word on that just yet.